why who we are depends on who we are to each other. Most moral theories in bioethics begin by asking a familiar question: what kind of being deserves moral status? They look inward at traits, capacities, or biological facts. Relational theory begins somewhere very different. It asks instead, who is this being connected to, and how do those connections generate moral responsibility? The relational theory of moral status makes a striking claim. Moral status does not arise from intrinsic traits alone. It arises from relationships. We matter morally not simply because of what we are, but because of how we are embedded in networks of care, dependence, and responsibility. This theory begins with an observation about real human life. We are never isolated moral units. We are born into families. We grow within communities. We age within systems of care. We suffer within relationships. We die surrounded or abandoned by others. Moral life does not happen in abstraction. It happens between people. Relational theory challenges the idea that moral worth must be earned by intelligence, autonomy, or even sentience. Instead, it emphasizes moral significance through connection. A newborn matters not because she is rational. She matters because she is someone's child. A person with advanced dementia matters not because of current cognitive capacity. They matter because they are someone's parent, spouse, sibling, or friend. A severely disabled individual matters not because of independence, but because they stand within a web of care that generates obligations. In this framework, dependency is not a moral weakness. It is a moral signal. The more dependent a being is, the stronger the relational obligations may become. This is a radical inversion of autonomy-centered ethics, where autonomy asks, what choices can this person make? Relational ethics asks, what responsibilities do we have toward this person, given our relationship to them? One of the greatest strengths of relational theory is that it reflects how moral life actually works. In practice, we do not treat strangers and loved ones the same. We do not owe identical duties to every human being. We feel deeper obligations toward our children, our parents, our patients, those entrusted to our care. Relational theory does not try to erase these differences. It takes them seriously. This is why relational theory is especially powerful in contexts of vulnerability. Infants are not morally marginal because they are dependent. They are morally central because they are radically dependent. The same is true for children, the disabled, the chronically ill, the elderly, the dying. In relational ethics, vulnerability increases moral claim. The weaker the voice, the stronger the duty. This orientation explains why relational theory plays such a major role in care ethics. Care ethics does not imagine moral agents as isolated choosers. It imagines them as caregivers and care receivers. It emphasizes attentiveness, responsibility, responsiveness, trust. Moral failure, in this view, is not merely violating a principle, it is abandoning a relationship. Relational theory is therefore central to feminist bioethics, which critiques traditional ethics for privileging independence, abstraction, and neutrality. Those values, feminist ethicists argue, reflect a narrow moral experience, often male, often privileged, often insulated from dependency. Relational ethics insists that care work, emotional labor, and dependency are not morally secondary. They are morally foundational. The theory is also deeply influential in disability ethics. Disability advocates have long argued that measuring moral worth by independence or productivity marginalizes those who rely on others. Relational theory reframes disability not as moral deficit, but as a site of shared responsibility. The ethical failure is not dependence itself. The ethical failure is when society refuses to carry its share of care. In pediatric and elder care ethics, relational reasoning is unavoidable. Children cannot consent in the full sense. Elderly patients may lose decisional capacity, yet moral obligation does not disappear. Instead, it intensifies, because relationships persist even when autonomy fades. But relational theory is not without serious challenges. One major critique is cultural relativity. Relationships are defined differently across cultures. Family obligations vary, social roles vary, care expectations vary. If moral status depends on relational context, critics ask whose relationships count and by whose standards? Another concern is moral inconsistency. If moral status depends on relationships, what happens to the socially isolated, the orphan with no family, the elderly person with no visitors, the marginalized individual cut off from community? Does their moral status diminish simply because their relationships have failed? Relational theorists insist this is not the conclusion, but the worry remains. There is also a significant legal challenge. Law prefers clarity, rights prefer universality, courts prefer principles that apply evenly. Relational ethics resists clean formalization. It requires judgment, context, narrative, attention to particulars. This makes it powerful at the bedside, but difficult in statutes. And yet, relational theory persists because it names something many other theories miss. Human beings are not merely biological organisms, sentient subjects, rational agents. We are relational selves. Our identities are formed through attachment. Our moral lives are sustained through care. Our worth is recognized through belonging. Relational theory does not deny the importance of biology, sentience, or autonomy, but it insists that none of these alone explains why we care for one another. It is not just what you are that matters, it is who you are to others and who we are called to be for you. The theory leaves us with a demanding moral question. If moral status arises from relationship, what responsibilities do we bear toward those who depend on us, especially when they can give nothing back? How we answer that question shapes the ethics of care, vulnerability, and human solidarity itself.